Hello guys, welcome back to Corpus. Today we are going to talk about Parkinson's disease, what exactly happens in it, and few simple home exercises which will improve your balance and the body flexibility. Parkinson's disease is actually a chronic and slowly progressive disease of a nervous system which mainly includes your brain. In our brain, there is one part called as basal ganglia. In basal ganglia, there is one part called as substantia nigra, and there are some cells in it. So these cells, they produce one chemical called as dopamine, which mainly helps to improve your control over movement. But in Parkinson's disease, these cells get affected and the production of this chemical dopamine is reduced, and therefore the control over movement is also reduced. There are also some changes happening in the movement. Parkinson's disease is commonly seen in the age group between 50 to 60 years of age and even between 21 to 40 years of age. The chances of getting Parkinson's disease increase with the increasing age. Now, let's look at the common features of Parkinson's disease. Patient suffering from Parkinson's disease usually complains of stiffness of their hands and legs, that is called as rigidity. So rigidity means the patient will feel stiffness, heaviness in the limbs, and also because of which the movement performance also becomes very difficult. The second one is bradykinesia. Bradykinesia means slowness in movement. The movements will become slow. Transitions means if suppose you are getting out of the bed, that movement will be slow. If you're climbing steps, the movements will be slow and difficult. The third one is tremors. So Parkinson's disease patients usually have resting tremors. During rest, they get pin rolling tremors, and that is the first thing, that is the first sign that we observe in Parkinson's patients. Next is postural instability. Postural instability is one of the important features of Parkinson's disease. In postural instability, there is a muscle weakness. So because of the muscle imbalance, some muscles are weak, some muscles are shortened, because of which the posture becomes very unstable and there are chances of fall also. Hypomimia is one of the important features of Parkinson's disease, that is expressionless face. So when you look at the face of the Parkinson's disease, it is like, with less expressions, and it is also called as a masked face. If you look at the handwriting of a person suffering from Parkinson's disease, you will see the handwriting abnormally small. So that abnormally small handwriting is called as micrographia. One of the most important clinical feature of Parkinson's disease is gait abnormalities. Now, what is gait? Gait means pattern of walking. So in Parkinson's disease patients, you will find a typical pattern of walking. For example, shuffling gait. Shuffling gait is actually when a person walks, there is a little hesitation or confused while taking steps. That is called as a shuffling gait. Then coming to freezing gait. Freezing gait means while the patient is walking, he may stop at one spot and unable to move forward. He just gets stuck at one point. That is called as freezing gait. There is a reduced arm swing, that is when you walk, we normally swing our arms. So in Parkinson's disease patients, you will find this arm swings reduced. In advanced stages, patients with Parkinson's disease, they exhibit a kind of a stooped posture while walking. That stooped posture is mainly because of muscle weakness and that leads to postural instability also. Now these were the important features of Parkinson's disease. As you all know, that in Parkinson's disease, because of postural instability and muscle weakness, the balance of the patients gets hampered, and because of which there are more chances of fall also. So now I'm going to teach you some simple exercises which you can do at home to improve your balance and even the flexibility of your body. To improve your balance and prevent falls, balance exercises are important, but at the same time, you need to improve the flexibility of your body also. So the first exercise will improve your flexibility of your mid back, upper back, and the flexibility of your chest muscles. So lift your hands up and then move it out and behind. So there should be a squeezing of both your shoulder blades. So lift it up and move it behind, so you'll get a stretch over here. Second one is rotations. So you have to rotate this way, keep your legs fixed to one place and rotate as much as possible. Third is side bending. For side bending, you have to stand straight and keep your shoulders relaxed, and you just have to touch your hand to your knee. So try to touch, you will get a proper stretch on this side. So this improves the mobility of your spine. Balance exercise, we need to start with heel raises. To do heel raises, you can take support of a chair or support of a wall, and once you are comfortable with it, you can slowly remove that support and do the activity. So for heel raises, you have to stand straight and raise your heel. If you want support, take a support of one hand and raise your heel. From sideways, it looks like this. Second one is just reverse of heel raise. That is, you have to raise your forefoot, your foot up on the heels. So it will look like this. You have to stand straight, take support of a chair or a wall, and move your toes, your forefoot up. Sideways, it looks quite this way. The next one is sit to stand. So this improves muscle control of your hips and also your knees, around your knees. So you have to sit on a chair or a sofa. Okay, keep your back straight, keep your foot shoulder width apart, and stand. You have to make your knees straight, back straight, and sit slowly as controlled as possible. Then again, stand. The next exercise is bending your knees. Again, you have to take support if you want support of the wall, support of the chair, and once you're comfortable, you can leave the support. So here you are bearing weight on only one leg. So stand straight, take support, and bend your knee. So once you're comfortable, leave the support, bend your knee, keep it back, bend your knee, keep it up. This you have to repeat on both the sides. Next one is hip raises. So here we should not bend the knee, but you have to raise the heel or raise the knee in the air. So take support on one leg, lift the other leg up, up and down, up and down. The next one is hip abductions. Similar way, you have to take support. If you're comfortable without support, of course you can do without support. So you have to move your leg out. So take support and move out again. So weight bearing on one leg, other leg will be moving out. Repeat on the other side also. Now on the spot marching. On the spot marching, you have to stand at one place. Okay, take support of anything and then move your march on the spot. So don't do it faster, do it slowly. The last exercise is a little bit progression. It's a progression of all these exercises. So you have to stand straight, take one step in front. Okay, so you have to balance this way in this position. Okay, and you can do any hand movements. You can lift the hands up or you can move it sideways. Okay, balance on in this position and take your one leg back. Similarly on the other side, one step forward, do any activity in the upper limbs and then back. So guys, I hope all of you have followed our today's video on Parkinson's disease. So for more updates on fitness and other conditions and simple exercises to manage them, please stay tuned, subscribe to our channel, share and like the video.
For more content on health and fitness, do like this video and subscribe to our channel.